My name is Refilwe Mohuru Tshane from Botswana, currently enrolled in Krishna Visha Vidyapith, enrolled under the radiation oncology training as a radiotherapy technician. How I found out about this program is through the Office of the First Lady of Botswana in collaboration with Merck Foundation, and that is how I landed the scholarship. Botswana has a population of about 2 million, and as of date, it has less than 10 oncologists, which are located in the city of Botswana, which is in the southern part of our country. And this makes it very hard for people in the rural areas to reach them because of transport. Other challenges that we face are lack of trained personnel such as pathologists, radiation therapists, and medical physicists. Also, in addition to lack of personnel, the other challenge that we face is lack of machine and equipment, because the two main treatment modalities for a very long time were surgery and chemotherapy. And it was only later where one machine, LINAC, was availed for the whole entire country. It was available for so long until only earlier this year where a second LINAC was purchased to cater for the whole country. But however, the International Energy Atomic Agency recommends that for a population of 2 million people, there needs to be 4 to 8 LINACs to cater for the whole population. So those are some of the challenges that our country is currently facing, and we're hoping that the government gets into these initiatives so they're then able to purchase to curb the cancer disease. The two critical, most important things that could improve cancer care in my country, firstly would be training of medical staff. That would include medical oncologists, medical physicists, pathologists, radiotherapists, and so on. This would be helpful in treat the patients at the earliest, because at times patients come and because they meet a general doctor, their diagnosis ends up getting delayed because there's lack of skilled personnel. Another thing that would be of importance is purchasing of equipment, critical equipment, because shortage then means either patients get sent out of Botswana to seek for example, imaging in terms of diagnosis of cancer and staging and so forth. So skilled personnel and equipment would be of very importance. Also the skilled personnel, because sometimes you find that the equipment is there, but not the people that are there cannot use the equipment. They don't know how to use it, so that would come in handy. This is important because it will help improve patient quality care on our side, because after this training we're equipped with knowledge and skills on how to handle different cases that are presented to us. Having been through the 6 months, we've been exposed to so many different cases, and we know how to handle them, right from planning treatment and assessment right through to treatment of the patient. So this will help me personally grow in my academic growth, and in my country it will help curb the shortage of skilled manpower. So prior to joining, my expectations were to be exposed to different treatment techniques and treatment planning techniques as well, to see as many different cases as possible. And I can say that has been achieved. We've been exposed to so many different cases. We're in on the treatment planning. So this has been a really helpful experience. The area of exposure that we've had at this institution have been simulation for treating patients with cancer, for planning their treatment. We've been exposed to, since we're under the radiation oncology, we've been exposed to the radiotherapy machine, which is currently the LINAC. It's the one they're currently using for treatment of patients. We've also been exposed to the brachytherapy department as well. And in terms of diagnostic radiation, we've been exposed to the CT scan and the mammography. So those are the ones that we've been exposed to that will be really helpful going forth. This training will be helpful in that it will, since I will be now amongst the skilled employees, I will help reduce the workload, if I may put it that way. Since currently there's a shortage of employees skilled in this field, so this post my training, I will return back to my country and add on to the numbers and curb the shortage of skilled manpower. My advice would be that they take it seriously. It's a very short time for training, so they should get to it as soon as they start. Do not delay in your learning, in your getting exposure. Get as much exposure as possible. Be inquisitive, be participating, be willing to learn, because this training will take you far in your career in helping you and your country. I would like to thank Merck Foundation along with the Office of the First Lady of Botswana for this opportunity for training at KVV. I would also like to thank the staff of Krishna Vishwavidyapith for their immense help in our training and helping achieve and learn and gain all the skills and knowledge that we have attained. Botswana!